Imagine waking up one morning, and for just a moment, your arm feels numb. A few minutes later, your speech feels slurred, or you can't quite find the right words. Then just as quickly, everything seems normal again. No pain, no lingering effects. Easy to dismiss, right? But what if that fleeting moment was your brain's first and only cry for help? Every year, thousands of Americans, many over the age of 65, experience what's known as a mini stroke. And while the word mini may sound harmless, the truth is far more serious. These events, called transient ischemic attacks, TIAs, are not the main storm. They're the siren before it, and what follows can be devastating. Here's the chilling fact. Nearly 1 in 5 people who suffer a mini stroke go on to have a major, often life-altering stroke within just 3 months. For older adults, the risks climb even higher. But the silver lining? These silent warnings often come with signs, if you know how to spot them. In this video, we'll walk you through the 8 critical symptoms you must never ignore, even if they only last a few minutes. We'll also explore what causes mini strokes, who's most at risk, and, most importantly, what steps you can take right now to prevent a more serious event from ever happening. Because when it comes to protecting your independence, your mind and your life, knowledge truly is power. So stay with us. What you'll learn in the next few minutes could save your life or the life of someone you love. 1. What is a mini stroke? A mini stroke, medically known as a transient ischemic attack, TIA, is like a fire drill for your brain, a warning that something's seriously wrong, even if everything seems fine afterward. Unlike a full-blown stroke, a TIA doesn't cause permanent damage. That's because the blockage that briefly interrupts blood flow to the brain typically resolves on its own within minutes to a few hours. But don't let the word mini fool you. Just because symptoms fade quickly doesn't mean the danger has passed. Think of it this way. If a smoke alarm went off in your home, you wouldn't ignore it just because the smoke cleared in 10 minutes. The same applies here. A TIA is often the brain's only chance to wave a red flag before a more devastating stroke occurs, one that can result in paralysis, speech loss, or worse. For older adults, understanding this distinction is critical. Many people mistake a TIA for fatigue, low blood sugar, or simply getting older. But recognizing these warning signs for what they truly are could mean the difference between a close call and a life-changing event. The key takeaway? A mini stroke is temporary in symptom, but urgent in meaning. 2. Why recognizing a mini stroke matters. Recognizing a mini stroke isn't just important, it could save your life. Here's why. Studies show that nearly 1 in 3 people who experience a TIA go on to suffer a major stroke, sometimes within just 48 hours. For seniors, this window is even more critical. The symptoms may vanish quickly, but the risk doesn't. A mini stroke is your body's early alarm, not something to dismiss as a fluke or a bad day. Too often, these warning signs, slurred speech, sudden dizziness, or vision trouble, are chalked up to aging or fatigue. But that delay in action can have irreversible consequences. A full-blown stroke can mean permanent paralysis, loss of independence, or even death. The good news? Acting fast can stop disaster in its tracks. When doctors catch a mini stroke early, they can intervene with medications, lifestyle adjustments, or treatments that dramatically reduce the risk of future strokes. In short, identifying and responding to a TIA isn't just about reacting, it's about preventing the unthinkable. If you're over 65, knowing these signs and taking them seriously might be one of the most important things you do for your health. 3. Warning sign. Sign 1. Sudden weakness or numbness. Don't brush it off. One of the most common and easiest to overlook early signs of a mini stroke is sudden weakness or numbness, typically affecting one side of the body. It might show up in your face, arm, or leg. You may feel like one side is heavier, tingling, or strangely asleep, even though you haven't been lying on it. For older adults, this can easily be misinterpreted as arthritis acting up or a pinched nerve. But when it comes on suddenly and without explanation, it's time to think beyond ordinary causes. This kind of asymmetrical sensation happens because blood flow to a part of your brain, especially one that controls movement or touch, is temporarily interrupted during a TIA. And while the feeling may fade within minutes, the danger has not. Here's the critical point. Even a brief episode like this is your brain trying to get your attention. It's not just discomfort, it's a signal. And if ignored, it could be followed by a much more damaging stroke that doesn't go away. So if you or a loved one feels sudden numbness or weakness, especially on just one side, don't wait and see. Call 911. Your future independence might depend on it. Sign 2. Sudden vision changes. Your eyes might be telling you more than you think. Have you ever experienced a moment when your vision suddenly became blurry, doubled, or even darkened in one eye, like a curtain dropping out of nowhere? If so, it might not just be eye strain or fatigue. For older adults, this can be a red flag for a mini-stroke. When a TIA affects the parts of the brain or optic nerve responsible for sight, it can temporarily disrupt your ability to see clearly. This isn't about needing new glasses, it's about your brain not getting enough oxygen. One specific condition called amaurosis fugax causes temporary blindness in one eye and often feels like a shadow slowly falling across your vision. It usually lasts just a few seconds to minutes, which is why many people ignore it. But here's the truth. These fleeting episodes are urgent warnings of potential stroke activity. If you or someone you love notices sudden, unexplained changes in vision, especially if it's one-sided or paired with other symptoms like numbness or dizziness, don't wait for it to happen again. Get medical attention immediately. Your eyesight and your life could depend on catching the problem before it escalates. Signs 3. Slurred speech or word struggles. When your voice doesn't work right, imagine trying to say something simple, like your name or where you are, and suddenly the words come out jumbled, slurred, or not at all. You know what you want to say, but your mouth won't cooperate. This isn't just frustrating, it's a classic warning sign of a mini-stroke. During a TIA, the brain's language centers can lose oxygen for a short time, making it difficult to form or understand speech. This may show up as slurred words, stuttering, or even complete silence, even though you're fully conscious and trying to speak. Many people mistake this symptom for fatigue or nervousness, especially if it passes quickly. But here's the catch. Just because your speech returns to normal doesn't mean you're in the clear. It could be your brain's first and only warning before a full stroke takes away your ability to speak for good. If you or someone you're with suddenly starts having trouble getting words out or sounds confused when speaking, don't wait. Call 911 immediately. The faster you act, the better your chances of avoiding permanent language loss and preserving your ability to communicate clearly. Sign 4. Sudden confusion. When your mind feels lost without warning, one moment you're fine, the next you can't remember where you are, what you were doing, or even what day it is. This sudden mental fog isn't always just a senior moment. It could be a mini-stroke in progress. When a transient ischemic attack, TIA, affects the brain's cognitive centers, it can cause brief periods of confusion, disorientation, or difficulty concentrating. You might forget familiar names, get lost in your own home, or feel mentally off, even if physically you seem okay. This symptom is often mistaken for normal aging or early signs of dementia. But the key difference is onset. TIA-related confusion strikes suddenly and without warning, then fades. That makes it easy to dismiss and dangerously easy to ignore. But this mental hiccup is your brain waving a red flag. If blood flow is momentarily cut off to areas that manage memory and reasoning, even briefly, it signals that something much worse could be around the corner. So if you or a loved one experiences sudden, unexplained confusion, don't wait and wonder. Get emergency help right away, because with strokes, time lost is brain lost. Sign 5. Sudden dizziness or balance issues. When a simple step becomes a fall risk. Have you ever stood up and suddenly felt like the room was spinning, or that your legs just wouldn't support you? For older adults, this can be chalked up to dehydration, low blood sugar, or vertigo. But when it comes on fast and without clear reason, it could signal something far more dangerous, a mini-stroke. A TIA can briefly disrupt blood flow to the parts of your brain that control balance and coordination. The result? You might feel lightheaded, unsteady on your feet, or even fall without warning or explanation. What makes this so dangerous is how easy it is to dismiss. We often attribute balance issues to aging or a stiff joint. But when dizziness appears suddenly, and especially if it's paired with other signs like numbness or slurred speech, it could be your brain crying out for help. And here's the bottom line. Falls are no small matter after 65. They can lead to broken bones, hospital stays, and long recoveries. If a stroke is behind the imbalance, the consequences can be even more serious. So don't take chances. If dizziness or loss of balance strikes out of the blue, get checked immediately. Quick action could prevent a devastating stroke and a dangerous fall. Sign 6. Sudden severe headache when pain comes out of nowhere. Not all headaches are created equal, and some may be trying to tell you something urgent. If you're over 65 and suddenly experience a sharp, intense headache that feels different from your usual aches, it could be a warning sign of a mini-stroke. We all get headaches now and then, but a TIA-related headache tends to strike abruptly, without buildup, and may come with other symptoms like dizziness, vision changes, or numbness. Many describe it as a pain that just doesn't feel right, more piercing or unusual than a typical tension or sinus headache. Why does this happen? During a mini-stroke, a temporary disruption in blood flow can irritate blood vessels in the brain or cause sudden changes in pressure. While the symptoms often fade, the risk behind them doesn't. It's easy to brush this off, especially if you have a history of migraines or assume it's dehydration. But here's the truth. Your brain doesn't send out mystery pain for no reason. If a headache comes on strong and fast, and especially if it's accompanied by other red flags, don't tough it out. Call 911. Acting quickly could make the difference between a warning and a tragedy. Sign 7. Sudden fainting or extreme drowsiness, not just a nap attack. If you suddenly feel overwhelmingly drowsy, or worse, faint for a few seconds, it's tempting to chalk it up to low blood sugar, medication side effects, or a poor night's sleep. But for older adults, this brief loss of consciousness or unusual fatigue could point to something far more serious. A mini-stroke. When the brain experiences a temporary drop in blood flow, as in a TIA, it may not get enough oxygen to maintain full alertness. The result? You could feel lightheaded, disconnected, or fall asleep without warning, especially dangerous if you're driving, standing, or alone. What makes this symptom particularly tricky is its subtlety. It often comes and goes quickly, leaving the person unaware anything happened. But just because you wake up fine doesn't mean your brain didn't just send a distress signal. The key is to notice the pattern. If drowsiness strikes out of the blue and doesn't make sense in the context of your day, especially if paired with other symptoms like slurred speech or vision trouble, it may not be just tiredness. Don't ignore it. Seek immediate medical help. Your brain may be whispering a warning, and this time it deserves to be heard. Sign 8. Tingling or pins and needles. When your body starts whispering, that odd sensation, like ants crawling on your skin or tiny needles pricking one side of your face, arm, or leg, might seem harmless. Maybe you slept on it wrong. Maybe it's just a pinched nerve. But if that tingling comes on suddenly and without clear cause, it could be the subtle whisper of a mini-stroke. When a TIA temporarily blocks blood flow to the brain areas that control sensation, it can trigger numbness or that classic pins and needles feeling. It's usually localized to one side of the body and often disappears as quickly as it came. But just because the feeling fades doesn't mean it was nothing. What makes this sign so deceptive is how easily it's confused with everyday issues. But here's the critical difference. Stroke-related tingling often strikes without physical pressure or movement and can be accompanied by other red flags like dizziness, vision changes, or slurred speech. For those over 65, recognizing when a common symptom is actually uncommon in its behavior can be life-saving. So the next time you feel a strange tingle that doesn't add up, don't brush it off. It might not just be your nerves, it could be your brain's quiet cry for help. 4. Risk factors for mini-strokes in older adults. Mini-strokes don't happen randomly. They usually stem from underlying health issues and lifestyle patterns that quietly increase your risk over time. For older adults, these risks often build up without obvious symptoms until it's too late. One of the biggest culprits is high blood pressure, which places constant strain on your blood vessels, making them more vulnerable to blockages. Diabetes is another major factor. It damages arteries and disrupts healthy blood flow, especially to the brain. An irregular heartbeat, particularly atrial fibrillation, AFib, is especially dangerous because it can lead to blood clots that travel to the brain, triggering a TIA or full stroke. Add in high cholesterol and your risk multiplies. Lifestyle choices play a powerful role too. Smoking, a sedentary routine, excess alcohol, and poor diet all increase inflammation, reduce circulation, and make blood clots more likely. And unfortunately, these habits often sneak into retirement years unnoticed. The good news? Many of these risk factors are treatable and reversible. With regular checkups, medications when needed, and a commitment to heart-healthy living, you can dramatically reduce your chances of experiencing a mini stroke. Because prevention isn't about fear, it's about protecting your independence and your future. 5. Prevention and treatment. Your best defense against a bigger stroke. A mini stroke might feel like a near miss, but it should be treated as a second chance, not a one-time scare. The moment symptoms appear and disappear, the clock starts ticking. The good news? There are clear, proven steps you can take to reduce your risk of a future, potentially life-altering stroke. First, medications play a vital role. Your doctor may prescribe aspirin or other antiplatelet drugs to prevent clot formation. If you have atrial fibrillation or other heart conditions, blood thinners like warfarin or newer anticoagulants may be necessary. But medication alone isn't enough. Prevention starts with daily habits. Commit to a heart-healthy diet. Think fresh fruits, vegetables, whole grains, lean protein, and minimal salt and processed foods. Add 30 minutes of physical activity most days of the week, even if it's just a brisk walk around your neighborhood. It's also crucial to manage chronic conditions. Monitor your blood pressure, control your blood sugar, and follow up with your healthcare provider regularly. These aren't just numbers. They're early warnings you can act on. Mini strokes are preventable. The choices you make today, no matter your age, can mean a healthier, more independent tomorrow. 6. The role of family. Why support matters more than ever. Recovering from or preventing a mini stroke isn't something older adults should face alone. Family support can make a life-saving difference, not just in the moments after an episode, but in the days, weeks, and habits that follow. Often, older loved ones may downplay symptoms like slurred speech, numbness, or confusion. That's where family members come in. Being informed and alert allows you to recognize red flags they might overlook. Your quick response could mean faster treatment and better outcomes. But support goes beyond emergencies. Encouraging regular checkups, helping track medications, or even joining them for a walk or preparing healthy meals together adds accountability without pressure. Small gestures like setting reminders or offering transportation to appointments can ease stress and build consistency. Just as important is emotional encouragement. After a health scare, older adults may feel anxious, vulnerable, or even ashamed. Your presence, patience, and reassurance can lift that weight and keep them motivated to stay proactive about their health. In short, being there, physically and emotionally, can help your loved one not only recover, but thrive. Because when it comes to stroke prevention and recovery, family is often the strongest medicine of all. Mini strokes may appear small on the surface, but their message couldn't be louder. These fleeting events are often the brain's first, and sometimes only warning that a major, potentially devastating stroke could be right around the corner. If you're over 65, you already know how quickly health can shift. But the good news is, with the right awareness and action, you can take control before it's too late. Recognizing the 8 critical warning signs, from sudden numbness and slurred speech to vision changes and mental fog, isn't about panic. It's about preparation and protection. So what can you do starting today? Get your blood pressure and cholesterol checked regularly. Talk to your doctor about stroke risk, even if you've never had symptoms. Stay active, eat smart, and keep your blood sugar under control. And most importantly, Don't ignore what your body's telling you. If something feels off, trust your instincts. Quick action, calling 911 or seeing your provider, can prevent a mini stroke from becoming a full-blown emergency. And if you're a caregiver or family member, be the advocate your loved one may not know they need. Your support, knowledge, and attentiveness could save a life. Mini strokes are a second chance in disguise. Don't waste it. If this video helped you understand the risk better, share it with a friend or loved one. You could be passing on knowledge that saves a life. Subscribe for more health insights designed with you and your well-being in mind. Because staying informed is the first step to staying independent. Stay safe, stay sharp, and stay proactive.